So today I'm just going to take you through a short overview of One for the World's charity portfolio for 2018. Okay, so first thing to note is that there are three possible ways that you can give to charities through One for the World. We have a full portfolio of which we choose 5 One for the World top picks. So you can either choose to split your donation between One for the World's top picks, you can split your donation between our full portfolio of 19 charities, or you can choose to give to any one of these 19 charities individually. So today I'm going to do a short video giving a short overview of our 5 top picks. I think I'll spend about 5 minutes on each one. And then I'll send over a second video which does a much briefer overview of the remaining charities in our portfolio. All right, so let's get going with the top picks here. And first up is the Against Malaria Foundation. So we've recommended them since we were founded in 2014. They're a really great charity. They distribute long-lasting bed nets to prevent malaria infections. So malaria kills about 500,000 people each year. This is a huge number. About 70% of these deaths are children under 5. And there's hundreds of millions of cases of malaria each year. This is actually a number which is down significantly. So the number of deaths from malaria has fallen by about 50% in the last 15 to 20 years. And a large part of the reason for that is because the distribution of bed nets has become a lot more widespread. So this is very much a tractable problem. We know how to prevent malaria infections. We know how to do it very effectively and very cost effectively. And the most cost-effective way is distributing these long-lasting insecticide-treated bed nets. And this is exactly what Against Malaria Foundation does. So it costs them about $4 to purchase and distribute these bed nets. And this is an all-in cost. So this includes costs of kind of following up to make sure these nets are being used appropriately and evaluating their program. So they do supervision at the point of distribution. So when the nets are distributed in the villages, they make sure there are people there to make sure they're given to the right people, to teach people how to use them effectively. And then they do follow-up surveys every 6 months for 3 years. So yeah, we think there's a ton of evidence that what Against Malaria Foundation does works, and they do it very well. So let me tell you a bit more about this evidence. So you can see here on the right, so in this picture in the top right here, this is an example of people sleeping under bed nets, and you may have slept under bed nets yourself if you've been to a tropical country where there's a high incidence of malaria. Basically, you hang this net over your bed, and it protects you from mosquitoes kind of biting you at night, and you're most likely to be infected from malaria by being bitten at night. So that's an example, and here are the actual bed nets. This is a picture from a distribution from the Against Malaria Foundation in the bottom right of your screen. So there's a lot of evidence that these bed nets work. There's a large number of high-quality studies, including a bunch of randomized trials, that show that if people use bed nets, this reduces the number of cases of malaria and reduces child mortality. There's also strong evidence from a couple of economics papers which shows that it's better to distribute these nets for free than ask people to pay for them, even if the cost is even if the price is below the cost of distribution. So even if you subsidize these nets, fewer people take them up relative to if you give them to people for free. So AMF kind of tracks the needs for nets in various countries that it works at. It tracks infection rates, and it tracks the effective net usage in areas where they work. And they've got studies that show that they have about 70 to 80% utilization of nets. And then there's an economics paper which shows there's these kind of knock-on effects of decreasing rates of malaria. So there's one estimate that it comes this figure that if you spend $1 fighting malaria, then on average this would increase Africa's GDP by about $6.75. So yeah, this increases health, improves health, reduces child mortality, and also seems to have some economic knock-on benefits as well. So let me tell you a little bit more about AMF and how they've grown over the years. So this diagram shows the number of net distributions they've had since 2012, and we started recommending them in 2014. And you can see that as the Against Malaria Foundation has received more funding, they've been very effective at scaling up their program. and they managed to distribute nearly 15 million nets in 2017. So they also have a lot of additional net distributions planned between 2018 and 2020. So yeah, that's the Against Malaria Foundation. They're an absolutely outstanding charity. There's a lot of evidence about what they do having an impact, having a positive benefit on health and a reduction in child mortality. AMF themselves are a brilliantly run organization. So yeah, do check out our website and check out their website for any more details on the Against Malaria Foundation. Okay, next I'm going to talk a bit about Give Directly. So Give Directly are a relatively new charity, and what they do is they provide unconditional cash transfers to extremely poor households in Kenya, Rwanda, and Uganda. So the problem they're trying to solve is that there's still a large number of people, so about 10% of the world's population, who live on less than $1.90 per day. And the majority of these live in sub-Saharan Africa. So if people are living on these small amounts of money, then they face a number of challenges, and these include nutrition, clothing, health, education, housing, and many other kind of issues that come with being in the poorest 10% of people in the world. So Give Directly have a fairly revolutionary way of trying to tackle this, and they essentially just decided to start testing what would happen if you just give people money with no strings attached and allow people to do with it what they want to. And this is what we mean by unconditional cash transfers. So usually they give about $1,000 and they give it in 3 installments over a period of a year. And Give Directly have been testing this for a number of years now. So this is one of the things we really love about them, is they really do thoroughly test their program. So they've tested, for example, whether it's better to give it to a woman or a man, whether the size of the cash transfer has much effect, and whether the timing of the transfer has much effect. And they kind of adapt their program to kind of reflect the evidence as it comes in. One thing to note here is that they're also kind of testing basic income in Uganda. So rather than giving a household one big injection of cash over a period of 1 year, they're seeing what happens if you guarantee a smaller income flow over a larger number of years, and are testing to see whether that might have a bigger impact. But yeah, the main reason we recommend Give Directly is because they have great evidence of their main program, where they give households $1,000, having big positive impacts on people's lives. So the main paper we've used to kind of make this recommendation is by Haushofer and Shapiro. This is a 2016 economics paper. And they estimate that on average, if you transfer $1,000 to these poor households, this leads to a $270 increase in earnings, a $430 increase in assets, and a $330 increase in spending on nutrition. And we might be worried that people wouldn't spend this money very wisely, but they find that there's no increase in alcohol or tobacco spending. So it seems that people have a good idea of what they can do with this money, how they can improve their lives with it. And it seems like they spend it pretty well in ways that improve their livelihoods. Okay, so just to give you a few more details about how Give Directly works. So they take money from donors and they distribute it to some of the world's poorest people. And they do this by using mobile phone transfers. Because this technology is very cheap, and because it's a fairly lean charity, for every dollar you give, 83 cents of that ends up directly in the hands of some of the world's poorest people. And this is including all the possible costs. The way this number is calculated is you just take Give Directly's all-time expenditure and compare it to the total amount of cash transfers that they've distributed since they started running. So yeah, you can rest assured that they're running a very lean program here, lean operation, and the vast majority of your money will end up in the hands of some of the world's poorest people. So if you look on the right-hand side of the screen, the way they kind of do this is they target very poor communities, then they audit the communities to find the poorest households within them, and then they transfer money to these communities, and then they monitor what people spend their money on to help measure their impact. As I've noted, they're very rigorous with the testing and finding evidence of the best ways to run their program and the impacts it's having on the people that receive the money. It's a very scalable program as well. So they think they could use tens or hundreds of millions of additional dollars in the coming years. And they have plans to scale across multiple other countries in the next few years. Okay, so that's Give Directly. Basically, if you give to Give Directly, they take your cash and they give it directly to some of the world's poorest people. And there's very strong evidence that those people spend the money well, they know what they need, and it improves their lives in both the short run and the longer run. Okay, next up is Possible. So Possible runs in Nepal. And the problem here is that Nepal's constitution guarantees the right to universal healthcare, but in a lot of poor communities, especially rural communities that are far from the capital, Kathmandu, the healthcare is currently pretty low quality. So Possible have been operating there for a number of years, and they've kind of developed this model of providing high quality but very low cost healthcare in these very poor rural areas of Nepal. So the way they work is they use a hub and spoke model, where they set up a district hospital as the hub of their kind of low-cost healthcare system. And then the spokes are clinics that are set up in rural communities. And then they use community health workers to go to even more remote communities and kind of monitor health and prescribe medicines and to kind of deliver health products to communities that are very hard to reach. So they use electronic medical record keeping. They're very much integrated with the government, with government efforts, and they work very closely with the Nepalese government. And they can kind of see patients at an average cost of $36 per treatment. So they're very driven by impact. Actually, if you go on their website, you can download quarterly impact reports where they track and measure kind of key performance indicators. And you can kind of learn a lot about how they're progressing over time. So the main evidence of impact here, well, first let's talk about the scale for Possible. So since its inception, they estimate they've served over 500,000 patients, and their patient volume has doubled over the past 2 years. They don't have a randomized controlled trial on their program. I think this is partly because their program is developing a complete healthcare system, and so it's a lot more difficult to evaluate with a randomized controlled trial. But there is very strong suggestive evidence that their program is leading to an improvement in health and a reduction in mortality. So here they kind of they show that their intervention is very likely the cause of a 12% reduction in mortality in under twos. And this is basically by comparing areas where Possible has been working with areas where it hasn't been working between 2015 and 2016. And I guess like the best place to look at the evidence of impact is to go to Impact Matters, who've conducted an impact audit on Possible's program and have concluded that there's very strong evidence that Possible is having a big positive impact on the health of people that it serves. So just to kind of give you a bit more detail on their program, in 2017, they treated 150,000 patients. They completed renovation at their main hospital, and this is a hospital where they kind of do a lot of their training for their healthcare providers. And they've kind of observed an increase in what they call the institutional birth rate. So this is the number of women who are giving birth in an institutional setting, in a safe environment with trained healthcare providers. So this has now reached 95% in the areas where Possible works in the last couple of years. So in 2018, they've actually expanded significantly. So they've expanded their catchment population area by nearly 3 times. And this is basically by completing the expansion of existing facilities. And this has partly been at the request of the Nepalese government, and in particular in response to the 2015 earthquake, which required a lot of rebuilding of clinics. So yeah, they're currently also planning to expand further. So overall, Possible, rather than focusing on one key determinant of health, they kind of provide a full healthcare system, and it seems like their low-cost healthcare system seems to be having a very big positive impact on the communities they serve in Nepal. Okay, so I'll move on to Living Goods.